Tonight in Medical Rounds, if you have pulmonary hypertension, you'll want to pay close attention to this interview. All this month is dedicated to awareness of pulmonary hypertension. It's a type of high blood pressure that affects the arteries in the lungs and on the right side of the heart. And joining us live tonight is Dr. Dina Darsaklis. She's Cardiology Director of Pulmonary Vascular Disease at Hartford Hospital. Good evening, Dr. Darsaklis. Thanks for joining us tonight.
Good evening, Denise.
First of all, how does this happen? How do the arteries become so thick and narrow in the lungs?
That's really a great question. Scientists actually don't fully understand at this point in time what causes it, but what we do know is that the very small arteries that feed the lung tissue, called pulmonary arterioles, the vessel wall of those pulmonary arterioles becomes thickened and inflamed. So this in turn causes increase in resistance and leads to what we refer to as pulmonary hypertension. Now, downstream to these pulmonary vessels sits the right side of the heart, the right heart. And as the resistance in these vessels increases, patients develop right heart failure and all the symptoms that are associated with it.
Well, let's talk about those symptoms. How do you know if you have pulmonary hypertension, and how is it diagnosed?
So that's a great question also. The symptoms of pulmonary hypertension in the very beginning of the disease process, patients could have no symptoms at all to complaining of what we call dyspnea, which is shortness of breath. And this is a very common symptom present in many different disease processes. However, as the disease process progresses and patients develop right heart failure, then patients can start developing symptoms such as dizziness, palpitations, swelling around the abdominal area, the belly area, as well as the legs.
So what do we do about this, Dr. Darsaklis? What are the treatment options available?
So we have quite a few different treatment options available, and this ranges from inhaled medications to oral medications to external pumps with continuous medications running either under the skin or intravenously. All these medications basically dilate the pulmonary vessels, so to decrease the resistance in the pulmonary bed and so decrease the pulmonary hypertension.
That sounds good. We have a few seconds left, and I always like to ask, what's on the horizon? What is out there, the next possible treatment? We understand there might be something, an implantable pump maybe next year?
That's right. Approved in 2018, the FDA approved these implantable systems for Remodulin, which is one of these pulmonary vasodilators that dilates the pulmonary vessels. By being implanted sitting inside the patient's body, this is a safer mechanism as well as delivers the medication in an infection risk-free mechanism. The pumps so far are external, and so this poses a safety risk for patients if the pump gets nicked, because these continuous medications cannot be stopped, because if they're stopped for whatever reason, it becomes life-threatening for the patient. And by being implanted, it's a lot safer for patients.
That sounds great. Thank you so much, Dr. Darsaklis, for joining us tonight and for sharing that great information. For those of you at home, if you want to learn more, just call the number you see on the screen.